everyone! For today, I will be going to perform a return demonstration on how to properly assess the integumentary system, which includes the hair, the nails, and the skin. So first, we need to identify the patient and explain the procedure to the patient and answer any questions. So good day, ma'am. I am Angeline Tulauan from Medical Colleges of Northern Philippines, your student nurse for today. So ma'am, can I ask what is your name po?
I'm Joanna Michelle Harati.
Okay, ma'am. When is your birthday, ma'am?
March 20, 2000.
Okay, ma'am. How old are you po?
I'm 21.
Okay, ma'am. I'll ask that question just to ensure that I am with the right patient. So, ma'am, is it okay with you if I talk in English or do you prefer me talking in Tagalog po?
You can do both.
Okay, ma'am. Is it okay for you if I'll touch certain parts of your body, ma'am? Okay, ma'am. We will now perform the assessment just to ensure that your integumentary system are normal and not having a problem. Okay, ma'am? After that, ask the patient to remove clothing and put on the examination gown. Ma'am, pwede po bang mag-twist tayo ng gown na ito po? Assuming that the patient already put on the gown, we will now perform the hand hygiene. After performing the hand hygiene, we will now inspect the skin for coloration. So, ma'am, pwede pong pataas ng kamay niyo po. Kabila po muna. Skin niyo po. Then, inspect the skin for vascularity, bleeding, and bursing. Ma'am, pataas po ulit. Next is to inspect the skin for lesion. Next po. Okay po, wala naman pong lesion, wala rin pong cuts or any wounds and scratches po kung nakikita niyo po. Normal naman po yung skin niyo po. Next is to palpate the skin using the back of our hands to assess the temperature. Ma'am, is it okay if I touch your, certain parts of your body po sa, niyo po? Next is to palpate skin for texture and moisture. Ma'am, pwede ba taas ko ng kabila po? Next is to assess skin turgor by gently pinching the skin under the clavicle. Next is to palpate edema. Lesion are present, put on gloves and palpate the lesion. Also, inspect for the nail angle, notice any clubbing. Also, we will inspect for the shape and the color of the nails. Ma'am, yung nails po. We will just inspect the nails. Next is to palpate the nails and the capillary refill. Isa po muna. Inspect the hair and scalp, wear on gloves if lesion and infestation is suspected or the hygiene is poor. Since the hygiene of the patient is not poor, I will no longer put on gloves. If wearing gloves, discard them. perform hand hygiene. So ma'am, I have here the results of your assessment and I will be sending this to the attending physician and let's see what happens next. So ma'am, are there any questions or clarifications you want to ask me po? Okay ma'am, thank you for your cooperation ma'am and have a nice day po. Thank you. So good day everyone. For today, I will be going to perform a return demonstration on how to assess the head and neck. First, we need to identify the patient and explain the purpose of having an assessment of head and neck to the patient and answer any questions. So good day ma'am, I am Angeline Tulauan, your student nurse for today from Medical Colleges of Northern Philippines. Ma'am, can I ask what is your name po?
I'm
How old are you ma'am?
I'm 21.
And when is your birthday ma'am?
March 20, 2001.
Okay ma'am, I'll ask that question just to ensure that I am with the right patient. Ma'am, is it okay if I talk in English or do you prefer me talking in Tagalog po?
You can do both.
Is it okay ma'am if I touch certain parts of your head and your face po? Okay, after that, we will now perform hand hygiene. After performing the hand hygiene, inspect the head and face for symmetry, lesion, and distribution of facial hair. Also note for the facial expression and then palpate the scalp. Ma'am, so I'll just observe lang po. Ma'am, can you smile po? Sad face po. Okay ma'am, ipapalpate ko lang po yung scalp niyo po. After palpating the scalp, we will now inspect for the external eye structures, which includes the eyebrows, eyelashes, eyelids, and eyeballs. We also want to inspect for the cornea, conjunctiva, and the sclera. Note for the color, symmetry, edema, and the alignment. Okay ma'am? Mag-observe lang po ako. Okay po. Ma'am, pwede pong hawakan ko yung face niyo? Tingin po sa taas, ma'am. Okay po. Tingin po sa baba. Okay po. Next is to examine the pupil for the equality of shape and size, also the reaction to light, as we darkening the room and using a pen light to shine both of the pupils. To test the pupillary accommodation and convergence, ask the patient to focus on an object as you bring it closer to the face. So ma'am, pwede po bang mag-focus po kayo sa object na to? Ilalapit ko po sa mukha niyo po. Okay po. Thank you po ma'am. Next is to test the visual acuity of the patient using the Snellen chart. Ask the patient to read the smallest possible letters with both eyes first and one at a time. So ma'am, pwede po bang basahin niyo po yung letters na nakalagay dito sa chart natin? Both eyes open po muna ma'am. Okay. Go po. With patient 2 feet away, ask the patient to focus on your fingers as you move it to the 6th cardinal position of gaze. So ma'am, mag-focus lang po kayo sa dalawang fingers ko ma'am. Sundan niyo po kung saan siya pupunta. Okay po, dito po muna tayo sa right po. Okay po. Okay po. Next is to inspect the ear bilaterally for shape, size, and then we will palpate the ear and the mastoid process. So ma'am, itatouch ko po yung part ng ears niyo. Okay lang po ba sa inyo yun? Okay po. And then the mastoid process, we will just palpate it. Use whispered voice to test hearing. Stand about 1 to 2 feet away from the patient, out of her line of vision, and ask the patient to cover one ear not being tested and perform test to the other's ear. So ma'am, pwede pong pa-close nung isang ear niyo po na hindi natin i-test. Okay po. Ano po yung sinabi ko, ma'am?
Alcohol.
Ay, kabila po. Pen light. Ano po?
Pen light.
Next is to inspect and palpate the external nose. Ma'am, itatouch ko po yung case niyo ulit. Okay lang po ba? After that, palpate and lightly percuse over the frontal and maxillary sinuses. So, ma'am, from the frontal to the maxillary. Next is to occlude one nostril with the finger and ask the patient to breathe on the other side. Repeat the process to the other nose. Ma'am, pwede pong patakpan nung ilong niyo po kabila. Ayan po. Tapos mag-breathe po kayo sa kabila. Inhale, exhale. Exhale po. Kabila po. Exhale. May trouble po ba kayo while ginagawa yung pag-breathe po natin? Sure po kayo?
Yes.
Okay.
Next is to palpate the temporomandibular joint.
By placing the index finger over the front of our chin. So, makikapalpate po natin yung temporomandibular joint. Okay na po bang hawakan ko? And then, ask the patient to open and close the mouth. Ma'am, open po yung mouth natin. Close po. Isa pa po, open, close. Okay. Next is to perform hand hygiene and put on gloves as we want to inspect for the lips, the oral mucosa, the soft and hard palates, the gingiva, the teeth, and the salivary glands. After putting on the gloves, ask the patient to open the mouth wide and using a pen light and a tongue tape. Ma'am, pwede pong pa-open ng mouth natin. Inspect lang po tayo. Okay. Next is to inspect the tongue. Ask the patient to stick out tongue. Place the tongue blade on the side of the tongue. Ask the patient to move it from left to right and then inspect for the uvula by asking the patient to saying while sticking the tongue. And also inspect for the muscle tone and tenderness. Can you say po? Mapamove po ng left sa right po. And then, say po ma'am. I-stick out natin yung tongue natin. Dila po tayo. Labas po natin yung tongue. Okay. Okay po. And then, we will remove our gloves. And discard them. Next is we will perform hand hygiene again. And then, we will palpate the forehead to the posterior triangle of the posterior cervical lymph nodes using our finger pads in a slow circular motion. So, ma'am, hahawakan ko po ulit yung face nyo. Kailan po ba? So, from the forehead to the posterior triangle of posterior cervical lymph nodes. Next is we want to inspect and palpate the front and behind the ears, under the chin, and the anterior triangle of the anterior cervical lymph nodes. So, ma'am, okay, palpate the ear of the front, and then behind, and then under the chin, and the anterior triangle of the anterior cervical lymph nodes. Next is to inspect and palpate the left and right carotid arteries. Note that in palpating and inspecting the left and right carotid arteries, we should palpate one carotid at a time. So, ma'am, ipapalpate natin yung carotid arteries niyo po. Sa ano po muna tayo? Sa left po muna tayo. And then sa right po. Use the bell of the stethoscope in auscultation the carotid arteries. And then next, we want to inspect and palpate for the trachea, which is located in here. Ayan, palpate the trachea. And then next, we will inspect and palpate for the thyroid gland and note if enlargement is present. Use the bell of the stethoscope to auscultate it. Palpate the thyroid gland. And then, we will now palpate the supraclavicular area. So, So, which is located in here. We want to palpate it. Next is we want to inspect for the ability of the patient to move the neck. So, we will ask the patient to move the chin to the chest and the ears to the shoulders and vice versa. So, ma'am, pwede po bang pa-move nung chin natin papunta po sa chest natin po? Baba pa po. And then balik po. Yung ears naman po natin sa shoulders. Okay, sa kabila po. Taas po yung neck. Ma'am, baba na po. As I can see, ma'am, there's a difficulty sa pag-move ng head niyo po. May iba po ba kayong dinadamdam ngayon, ma'am?
Kasi, honestly, I have mild scoliosis.
As you can hear on the patient, she has a mild scoliosis. That's why she has a difficulty on moving her head. And after doing all the procedure, we will now perform hand hygiene. And that's it. That's how you do the assessment for the head and neck. Thank you for watching.